We'll see how to solve questions on aphasia and Mrcp part 1 or part 2 theory exams. Okay? For that, we'll understand the language pathway, wherein the spoken language is sent to the auditory cortex in the parietal area, and written and sign languages are perceived by the visual cortex in the occipital area. Now, these two signals are sent to the Wernicke's area, which is in the superior temporal gyrus, and it is supplied by the inferior division of the middle cerebral artery. Also, the Brodmann's area 22. Now, the signals from here are compiled and sent via a nerve bundle called as arcuate fasciculus towards the Broca's area, which lies in the inferior frontal gyrus, which is supplied by the superior division of the middle cerebral artery, usually on the left side in a right-handed person. These signals are sent to the motor cortex, which supplies to the muscles which produce speech. While solving questions, you will first see the fluency of the speech, then comprehension. If the speech is non-fluent, labored, halting, and the comprehension is intact, the lesion might be lying in the Broca's area, and the person will have an expressive aphasia. Again, the inferior frontal gyrus will be affected, and there might be an infarction in the superior division of the left middle cerebral artery. In this case, again, because the person cannot produce words, the repetition will be poor. Okay? But the comprehension here will be intact. If the comprehension is impaired and the fluency is gone, matlab the person is almost mute, in this case it is called as global aphasia. There might be a large lesion which is affecting all the three parts, like the conduction, the comprehension, the motor, everything is affected. So there can be severe expressive aphasia as well as receptive aphasia. So in this case, the person will communicate with gestures. Fluency, if the speech is fluent but it does not make any sense, or there's word substitution, neologism, new words are formed, and the comprehension is impaired, that means the lesion lies in the Wernicke's area, which is a superior temporal gyrus. So in this, the repetition is impaired, of course, understanding is gone. This is also known as receptive aphasia, Wernicke's dysphasia. The inferior division of the left middle cerebral artery will be infarcted. You will have a word salad in the question, like the person makes the word salad while speaking. If the comprehension is intact and the person has got fluency, but still it does not make any sense, the lesion lies in the conduction of the signals, and it might be in the arcuate fasciculus. In this particularly, they will mention that the patient is aware of the errors. Again, in this case, the repetition will be poor. Now, another entity is the transcortical motor aphasia. So this is usually when the patient is recovering from a Broca's aphasic phase. This can happen, and the lesion the problem will be in the anterior superior frontal lobe. There might be halting, effortful speech, there will be impaired writing, but the comprehension and repetition are good in this case. So we'll solve a few questions. Here, an 80-year-old right-handed woman has recently been admitted with an acute ischemic stroke affecting part of the left hemisphere. So the dominant part has gone since she is right-handed. She is seen in the clinic a month later, and she is able to understand questions. So comprehension is intact. Produce fluent connected speech. So here the fluency is intact and comprehension is intact. So it is most likely conduction aphasia. We'll still read the question. However, she frequently substitutes incorrect sounds. When she makes an error, she notices but finds it difficult to correct the error. She is unable to repeat phrases. What type of aphasia she has? So in this is a clear case of conduction aphasia. Okay? Because the speech is fluent, the comprehension is intact, and she is aware of the errors, repetition is poor. This is conduction aphasia. A 72-year-old male has a fall, a CT is done in this, there is no hemorrhage and they give aspirin. Right sided facial droop is there, matlab there has to be somewhere left lesion most probably. Unable to get the words out easily and his speech is non-fluent, as if hesitating before uttering the words. During cranial nerve examination, he understood and followed your instructions. So here the speech is non-fluent, but comprehension is intact. So it is mostly Broca's area. During cranial nerve examination, he understood and followed your instruction. However, he is unable to repeat words. So repetition is word because he can't form the words. What type of speech disturbance does the patient have? So this is Broca's dysphasia. Again, one more example. An 84-year-old woman comes with confusion. She is alert. Her Glasgow Coma scale is 15/15. She speaks quickly and fluently, but does not make any sense, does not follow instruction, fails to repeat words, responds with meaningless and long sentences. So this might be fluent, okay? Comprehension is impaired. Repetition is also impaired. So this might be Wernicke's aphasia. So the lesion is in the superior temporal gyrus and this woman is suffering from Wernicke's aphasia. So that's it.